Welcome. Our presentation tonight is going to be on the topic of living kidney donation. My name is Michelle Lynn Goodfellow, and I'm the Communications and Engagement Manager for the PKD Foundation of Canada. The foundation is the only national organization that's solely dedicated to fighting polycystic kidney disease through research, education, advocacy, support, and awareness. We're thrilled today to bring you this patient education programming, which is made possible through gifts from our donors and sponsors. In this webinar, we'll be hearing from Canadian Blood Services about the living kidney donation process, from the Transplant Ambassador Program about their supports and resources for kidney transplant recipients and living kidney donors. And we'll also hear a patient story from a woman who donated one of her kidneys to her aunt with PKD. Before we hear from our first speaker, I just want to bring to your attention that this presentation is being recorded and it will be available soon on our YouTube channel. If you have any questions or comments, I invite you to share them in the comment box or the Q&A box. After each individual presentation, we'll have plenty of time for a live Q&A. So we encourage you to stick around for the entire event if you're able and hear from fellow PKD patients and loved ones about how this topic affects them. Our first speaker, Darlene Jagusic, is a program manager for Canadian Blood Services and leads the kidney paired donation program and the highly sensitized patient registry. She's a critical care trained registered nurse, and she has spent many years in intensive care units in BC and Saskatchewan. She has organ and tissue experience working for the Saskatchewan Provincial Transplant Program, both as a living and deceased organ coordinator prior to her current role at CBS. So now I'll hand over the floor to Darlene, who will be speaking about the process involved of becoming a living kidney donor and receiving a living kidney donation. Darlene.
Thank you, Michelle. Thank you for the lovely introduction.
You're welcome.
Just going to share my screen here with everybody. And we'll get started. Okay, so I apologize in advance. You know, medical people, we always use acronyms and we love lots of numbers. So I thought I would start here just with some statistics for information's sake. So why am I here today to talk about living donation? As you can see from the slide here, so we've broken down some numbers from 2022 into 2023 for Canada about transplants for deceased and living donation. And so there hasn't been a lot of change in living donation rates in the last few years here in Canada. But we know that there are many patients who are waiting to receive a kidney. And we also know, unfortunately, last year in 2 years ago now, in 2022, we lost 277 patients while they were waiting for an organ transplant. So very important topic. Currently, we see on the wait list almost just over 3,400 patients at year end this year waiting for an organ transplant. So just some fun stats to kind of go over with you, because we have many Canadian firsts to celebrate here. So I'm not sure if you're all aware, but you know, in 1956, so we did the first heart valve transplant in Toronto at that time. 1958, identical twins received kidney transplants in Montreal. 58 to 68, the discovery of HLA. In 1963 there, we did non-identical kidney transplants in Montreal and then Saskatchewan. Moving on to the 70s, liver transplantation in Montreal, and then into the 80s, a whole bunch of firsts for Canada for heart and lung single and double transplants there. Moving into the 90s, living related, so mother to child liver transplantation happened for the first time in London, Ontario. And 2000s there, so the first adult living related liver transplant in London there. So I feel like as Canadians, we should all be pretty proud of all of the accomplishments in transplantation over the years. So from my neck of the woods over here in CBS, what do we do and how do we help the national transplantation system? So we have something at CBS called the Canadian Transplant Registry. And so you can see the timeline there of the different organs and the abilities that the system has for us to bring together the nation and look for deceased and living transplant opportunities for patients across the country. It is a 24/7 system, and we have 400 plus users across the country that participate in the Canadian Transplant Registry. So here's how the sharing works in Canada for any of you that are interested. So the CTR, or the Canadian Transplant Registry from the previous slide, is operated by us here at Canadian Blood Services. And so the CTR matches available donor organs with potential waitlist recipients anywhere in the country. So this is a national web-based technology, and currently, again, more than 400 health professionals use this system coast to coast to find living and deceased organs for their patients. In the program that I manage, the KPD program, or Kidney Paired Donation Program, we have over 1,100 kidney transplants that we have accomplished to date here. The highly sensitized patient registry that started in 2013. And I'll explain a little bit more for those of you who aren't exactly sure what a highly sensitized patient is in a little bit. But we are also approaching a pretty big milestone in that registry as well, getting close to 1,000 transplants that have happened since that registry went live here in Canada. And so, you know, perspective on that, those are 1,000 transplants for some of the most difficult to match patients in the country. So amazing work from the interprovincial organ sharing registries and all of the provincial transplant and living donation programs across the country to come together in a truly pan-Canadian process. So transplants facilitated, again, just to give you a different visual, through our interprovincial kidney sharing registries that we manage here at CBS. So starting there in 2008 all the way up to 2024, the amazing transplants that have taken place there. And we're hoping to make that number even bigger as the future goes on. So as I'm going through all these numbers, you might be asking yourself, when we're thinking about kidney transplant, we do have dialysis for patients. So why would you want to consider a kidney transplant? So as you can see from the graph here, that we know research-based that kidney transplantation, living and deceased, can provide additional years of life and extend life for transplantation versus dialysis. So now, staying with the theme of transplant candidates for a moment before I move into living donation, I just wanted to explain a little bit about highly sensitized patients. Okay, so I have this little visual here of this group of people. So of the many people that are out there that need a kidney transplant, there are a portion of these potential candidates that we refer to as highly sensitized. And I'm sure you may have heard that word out there before, but what does it actually mean? So out of that group of people that you saw in the initial slide, 25% of that population there of patients who need a kidney would be considered highly sensitized. And so what does that mean for their transplant options? So essentially it means that less than 5% of those will be successful in finding a suitable donor. So what causes sensitization? So this slide here just explains that sensitization essentially is your immune system that creates antibodies. And those antibodies can be created for females from pregnancy, blood transfusion, or from those that have had a previous transplant. Now, it is a very complex area of medicine because we know that not everybody forms antibodies, and the degree of what we call sensitization, or the level of antibodies, is estimated by a blood test that we do for patients. And so you may have heard this word before, or this acronym. Again, we love our acronyms in medicine. It's called the CPRA. And so that stands for Calculated Panel Reactive Antibodies. And so that is a test that levels the percentage of antibodies that you have in your system. But again, you might be asking, what does that actually look like for patients when we're considering transplantation? So at the top of my screen here, I have a little figure that we're going to say is a sensitized patient, but with a low, what we call calculated panel reactive antibodies. So they're sitting at about 10%. So the white figures on the side there represent potential donors for those. And so if we look at cross-matching some of those donors to somebody who has low CPRA, there's a small portion of those donors that we know will have what we call a positive cross-match. So they won't be able to donate to that sensitized patient. However, we do know that there is a large portion of that potential donor pool that will be able to provide potential transplants to that sensitized patient. However, if we look at the figure on the bottom of the slide there, the highly sensitized patient. So as you can see, they have lots of antibodies. So they have a high CPRA of 99%. So what does that mean for them if we're looking at the potential donor pool on the right there? So that means there's a large portion of potential donors that they will have a positive cross-match for. So it means that they have a lower number of potentially matching donors available that could provide them organs. So their chances of receiving a transplant are less than the sensitized patient at 10%. But again, so going through all that's great information, but what does it mean for us, for patients? So if there is a donor organ that could be put into a recipient with antibodies to that specific donor, it can cause rejection of that organ. It can cause damage to that organ, and it can impact a patient's survival. So that is part of the reason that we use cross-match testing to avoid unknowingly transplanting an organ that may be rejected by someone who is highly sensitized. Okay, so now that I've gone through the whole highly sensitized, let's get into the topic that we're here to discuss tonight. So my favorite topic to talk about is living kidney donation. All right, so there are a couple of different types of donors. So most of us are born with 2 kidneys. However, we know that you can live a normal, healthy life with just 1 kidney. So what this means is that a healthy person can give or donate a kidney to someone whose kidneys are not working. And so this gift is called living kidney donation. So at the top there, I've referred to somebody that's considered directed donation. So that's when someone has a living kidney donor that donates directly to somebody they know, a friend, a relative, perhaps somebody they've met through social media. A non-directed donor is when the living kidney donor donates anonymously to anybody who needs a kidney. So typically what we refer to as non-directed donors can enter into the program that I manage, the KPD, the Kidney Pair Donation Registry, and they can donate anonymously to someone in need of a kidney, and that can trigger a chain of transplants. So that non-directed donor, that anonymous donor, not only provides life-saving transplant for one patient, they actually create a chain reaction to help the whole system. And many transplants can come from that. And so why should somebody potentially consider living kidney donation? So we know that through research, it is the best therapy for those patients that are suffering from end-stage kidney disease. Living transplants do better and last longer for the transplant candidate. They do better on average than deceased donors. The transplant candidate does not have to wait on a list until a matching deceased donor kidney is available, and it's their turn on the list when they match a kidney. The transplant candidate may actually even be able to avoid dialysis if they are able to find a living donor and get what's called a preemptive transplant, which we'll talk in greater detail if you have questions about a little bit later. The transplant candidate can be scheduled to have their transplantation done with living donation. It's more predictable than perhaps if you're on the deceased list. There is the potential you could get a call in the middle of the night for somebody to say, hey, we have a deceased offer for you. Would you like to accept this kidney? And there's psychological benefits. So, you know, the gift sometimes of the kidney can come from a loved one or a caring stranger. And it provides a positive experience through living donation. And the donor experiences the satisfaction of knowing that they've improved the health and saved the life of someone else and perhaps somebody they care about. And the big effect to the system is that it shortens the wait list time for others. All right, so you might be asking yourself now, who could be considered a living kidney donor? So any adult who is generally in good health. Most provinces require living kidney donors to be age 18 or older. Every potential donor must participate in a very thorough medical assessment and undergo many tests to ensure that they are healthy enough to donate one of their kidneys. There is no upper age limit for living kidney donation. Potential living kidney donors are evaluated based on their health and safety. So the focus is always on the donor health and safety before considering any potential donation to a recipient. The testing for a living donor is completed typically at one of the provincial living donation programs, and each province will have a specific process for a donor to begin screening and testing. I'll just go to the next slide here. So if you have questions about living organ donation, we do have information on our website at CBS. So we have some quiz under, am I eligible to receive a living kidney donor? Or am I able to be a living kidney donor? Sorry. What is living kidney donation? We do also have this information on our website in multiple languages, which is helpful. So you can go on and choose the language that is most familiar to you to review that information. Or perhaps you might want to download this information to pass on to a loved one if you're somebody who is potentially looking for a living kidney donor. The other information that we have on our website that a lot of patients find really helpful is we've created some transplant videos. So the first two videos on the left here, My Transplant Coach and My Paired Donation Coach, explain a lot about the transplant process. And then if for some reason you're not compatible with somebody who would like to donate to you directly, there's the My Paired Donation Coach, which explains in detail the kidney paired donation process. And then we also have a link to an international living donation storytelling project. And so you can see stories on there from both Canada and the United States. And so these stories are from people who've been a directed living kidney donor. They've been a non-directed anonymous donor. They've been a transplant kidney recipient. And you can watch and listen to their stories. They provide great detail from a personal perspective on what their transplant journey or donation journey was like. So I was able to receive a lot of questions ahead of time from the lovely Michelle. So I'm just going to talk a little bit and try and answer some of those questions here. Again, as Michelle mentioned, there will be the live Q&A at the end of the program tonight. So if you're able to stay and you have questions that I'm not able to answer in this presentation, please save those and we'll get to those. But one question I did come across is, does my donor have to be a family member? So there is a variability on assessing a potential living donor depending on the province that you live in. So a transplant candidate's transplant nephrologist. So once their dialysis physician refers them for transplant assessment, they will have a transplant nephrologist. They will know best to be able to advise the best choice for their patients, living donation, deceased donation, whatever. So that is your first point if you are somebody considering a transplant, to have that discussion with your transplant nephrologist. However, in general, when we're looking at living donation, anybody could be considered a living donor. So it does not have to be a family member. In my personal experience in practice, I had the most common relationship that I saw for living kidney donation was actually spouse. So, I mean, related through family, through marriage, but not necessarily blood related. So you do not have to have a sister or a mother or a brother donate to you. It can be anybody who could be tested. So what testing will I have to do was a question that came up. So testing for living donation is very thorough. I used to tell my patients it is probably the most thorough physical exam you will ever go through in your life. We test everything, and you will know how healthy you are at the end of that testing period, even if you decide not to donate in the end. I also used to joke with my living donors when they go for blood work to make sure that they were very well hydrated and had a good breakfast the night before, because we will draw lots and lots of tubes for blood work. Nobody likes anybody to faint in the lab. But again, depending on what province that you're living in, the donation program will have a specific testing process for living donation. Donor programs are also constantly looking at evolving their processes for living donation to make them as efficient as possible. Now, most programs, again, from my past experience, will start with a basic information on the living donor. So most often this is a phone call or some type of education session. Some programs do an online video. And so they provide the living donor with some information, and then they provide the living donor with a screening questionnaire. So a health history screening questionnaire to go through. The potential donor will have that discussion and a review of that questionnaire with the coordinator if the coordinator at the living donation program has any questions for the donor. So that questionnaire looks at health history, a donor's motivation to donate, because as I'm sure you all know, it is illegal to buy and sell organs in Canada. Past medical history, travel history, social behavior. Again, that process, that screening is very thorough. Then they will determine the blood group, so what blood type that the donor is, and if that blood type is compatible with their potential recipient, or sorry, transplant candidate. Most donors will often have a test that's called a cross match as well. So that is a very complicated test to explain. So I'll just put it in very, very rudimentary terms. Essentially, they're mixing the blood to see if that transplant candidate may react to that donor's kidney, to see if they could directly donate to their transplant candidate. This is one of the key tests that they do to determine if that donor could donate directly to their intended transplant candidate. After that, there are usually several blood and urine tests to determine if the potential donor is healthy enough to donate. There are also other tests required, like a chest X-ray. They do an ECG, so that's an electrical tracing of your heart rhythm. They'll do an ultrasound of your stomach and look at your kidneys as well. And then there's also some CT scans that they do, again, just to get a good picture of your kidneys. The CT scans are also, that's a test very specific to living kidney donors only. It's not something that would be done for you and I in a general physical exam with the doctor. Now, there is the potential, after going through all of that testing as a living donor, that you could get to the very final test and find out that for some reason, perhaps it's an anatomy issue, that you're not a direct match to your intended transplant candidate. That can be a bit devastating in my experience to have to pass on to donors after all that work and that hope to get across the finish line. But just know that the kidney pair donation is out there, and your living donation program will discuss that option with you as another way to find a match for your transplant candidate. So I'm healthy. Why do I have to do so much testing? Was a question that came up. And that's an excellent question. So some of the reasons why the living donation program will do testing for donors is also to kind of give you an idea of where your health is right now. And they have some calculations based on research that they can do to give you some examples of what your potential risks are down the road. Now, of course, you know, your physician will be able, your donation physician will be able to work with you to provide specific information. But in general, they can potentially, you know, give you your risk of, you know, having high blood pressure in the future, things like that after donation. So those health tests now that you're healthy are really good information to get a baseline for those physicians. So if you do decide to donate, they can very closely monitor your health in the future and make sure that you stay as healthy as you need to for as long as you need to. Another question I received was, when will you know if I'm able to donate directly to my intended candidate? So as I mentioned there, you may get through all of your testing and have the final test done and realize that you can't directly donate. Programs look at things like the blood group, the cross match that I mentioned, age matching, you know, does the donor have enough, renal function for the recipient, and the anatomy. So there's multiple tests that the Living Donation Program will look at to determine if that donor could be a direct match to their transplant candidate. So testing timeframes. So how long does testing take? Very common question that I receive all the time from patients. And unfortunately, it's a complicated question with not a really clear answer. And I apologize for that. But as I mentioned above, there is the general screening process and the blood work, the urine test, you know, the imaging that we do for donors. The other thing to consider as a donor is those are what we have for baseline safety testing for donors. If at all in that testing, your living donation program sees anything in that testing that they feel they need to investigate further, they of course will book further testing for you. So sometimes that can lengthen the time frame. It also depends on resource levels for a program. So how many staff do they have to organize testing? What is the testing availability at your center? Sometimes it does take, there's a wait list potentially for, you know, renal ultrasound, CT scans. So those are not always things that can be booked immediately for a living kidney donor. However, something I would like to mention tonight, that is kind of, as I alluded to before, programs are always constantly looking to evolve their testing process. There are some programs in Canada that are moving to an expedited donor testing option. And so they offer what's called a one-day donor clinic. And I put air quotes on that because of course there's always a caveat to that. But what exactly does that mean, a one-day donor clinic? So I don't have any affiliation with the Ottawa program, but I'm going to use them as an example here. So they have a story on the Ottawa Hospital's website about becoming a living kidney donor, and they showcase this particular directed donation pair. And so this is an excerpt here I'm showing you from an article written about the perspective of the one-day clinic. So if you read the article in its entirety, as you can see, it's not truly a one-day clinic. So the donor doesn't have all of their testing and is approved in one day, but it is a more efficient process than some programs have. So what happened in this article here is in March, the donor, Trina here in the story, was able to do her blood and urine testing on her own time. Then in April, so the next month, she had what's called the one-day donor clinic. So she went in for the donor clinic. She had all her diagnostic tests done and her consults with the physicians as well. And then the actual donation did not occur until July. So the testing part was expedited in the March and April sessions, when in some programs it can take anywhere from 6 to 10 months to get all of that testing completed for living donors. So that part is definitely expedited for this one-day donor clinic. But as you can tell, there's still some lag time between April and July there when the donor was actually able to donate. So just to kind of give some perspective on the estimates that it might take if you do decide to come forward as a living donor. The other thing to consider is a lot of this testing and the physician consults, really no matter what program you go to in Canada, is typically done on a Monday to Friday, kind of 8 8 to 4-ish basis. So if you are a living donor, who works between those hours, it does require, scheduling time off at work in order to attend those appointments and complete those tests as well. So one of the other questions that I received from Michelle ahead of time was, what about out-of-country donors? And I had a recent meeting that I checked in with some coordinators around the country here in living donation programs, and I just kind of asked, is this a common question, and how should I answer it? Because the process is very different depending on your provincial living donor program. So I think, my big message here is I'm providing some general information tonight, but if you have specific questions on how things work in your province, I always recommend you to reach out to your living donation program, and they will be the best to instruct you how their specific process works. But speaking from my prior experience as a coordinator, I did have experience with assessing living donors from outside of Canada. I have not heard about any programs that will assess and have donors from out of country that are considered altruistic. So most common donors that I've heard of are those donors who come forward and they have a family member in Canada that needs a kidney transplant, and they are willing to step up and potentially be assessed to provide that family member with a kidney. Now, depending on the country that potential donor comes forward to, there can be some costs involved in any initial testing that a living donation program would ask that donor to do. Some donors, depending on the country, will have health insurance that can cover some of that basic donor testing, but there is a list of blood and urine testing typically that the living donation program can provide to any potential out-of-country donors for an initial assessment to see if they could potentially donate to their loved one here in Canada. Now, I don't have exact costs because I'm sure, as you realize, it varies depending on the country. And like I said, there are some private insurance that will cover in certain countries. From my personal experience, I know that the out-of-country donors that I had work up, unfortunately, paid for that donor testing out of pocket in order to be able to come to Canada to donate to their loved one. Now, once some preliminary testing is completed, and this is based on the specific request for your provincial living donation team, the Transplant Candidate Center will also review that, and then most often, in my experience, it's up to the living donor to organize travel arrangements and typically a visitor visa to come to Canada. That 3 to 6 month window is usually, again, in my experience, when programs are asking. So they will repeat some of that blood and urine testing once that out-of-country donor does arrive here prior to the OR. Then they'll need to schedule the OR. And then there will be some recovery time for that potential out-of-country donor before they would return home. The other thing to consider for potential out-of-country donors is many of the living donor programs in Canada do require some contact with a physician or a nurse practitioner in the other country to ensure that when the donor goes home, that they will be looked after for any potential medical concerns that they might have after their donation recovery period and long-term follow-up. Now, if you're a potential transplant candidate, what is your eligibility to enroll in the kidney pair donation program? So if you have a potential living donor in another country, and you, the transplant candidate, reside here in Canada, you are able to enter the kidney pair donation program with that candidate. Now, logistics sometimes do get a little bit tricky, so it will be up to the living donation and the transplant programs to determine if they are able to facilitate an out-of-country donor to join yourself as a transplant candidate in Canada here in the kidney pair donation program. I just listed on the slide here some basic information that the KPD program provides to transplant candidates that have a willing potential donor to travel here to participate. So some other questions I received is about communication. So what communication happens between the transplant candidates team at the Living Donation Program, and then the Living Donors team at the Transplant Program. And so, as you can imagine, to protect privacy for both patients, the teams are kept separate. And so no private information is shared by the medical health team other than the very basics to help facilitate the transplant program. Now, most donors are counseled on this fact when they first call into the transplant program, that is their choice as a donor to share whatever they wish about their living kidney donation process. But there is limited information shared between the transplant candidate and the living donation teams for privacy for both medical assessments. Now, of course, if the living donor is assessed and is cleared for safe donation, there has to be some conversation between the two teams in order to facilitate an OR. So that would typically be the time that the teams would come together, mostly in my experience in like a multidisciplinary round scenario. They discuss, the case, and they start looking at scheduling OR dates. I know that a lot of people think that that's a very strange thing. I used to get questions from donors all the time. Well, I want to give them my kidney. Of course, you can share what you want. The caveat to always remember with that, though, too, is there could be something in your medical assessment that comes up, unbeknownst to you, something you were not expecting at all. That is something perhaps you don't want to share with your transplant candidate. And so that is part of the reason why those processes are separate, to protect privacy. So then that gives the power to the potential donor and or transplant candidate to share with their other, depending on what they feel comfortable with doing. I did get some questions about potential transplant candidates as well, wondering when they have many people call in to be a potential living donor, is there a list? Does the transplant program know? And so typically in that donor questionnaire that most donors are provided to fill out, there is a section in that questionnaire that will ask if you have an intended transplant candidate and then who that person is. So then the transplant program can work together to confirm that that is a transplant candidate within their program that could accept a living kidney. And then that living donor coordinator can start that process in a different area for that living donor. I don't know exactly how many living donors per program each program is able to work up for a transplant candidate. I know for resourcing issues, particularly in my experience, we did have limits on the number of living donors we could work up per time for a transplant candidate. And it's just resourcing, so person resources essentially, to complete those workups. And the final thing, I thank you all for your patience and your attention here, that I just want to draw your attention to is if living donation is something that's been on your mind, but you're not really sure if you want to engage in the process or undergo surgery for it, there's always the avenue to become a living donor champion for a potential transplant candidate. And I'm sure that our other speakers tonight will speak to this as well, but we do have some resources on the Canadian Blood Services website that you can go on, some social media tiles and some information that you could post on Facebook and Instagram accounts. There's some letter templates and videos to share to advocate for a living kidney donor for a transplant candidate, or if you're a potential transplant candidate, these are great resources for yourself to use as well. And then the final thing before I'll turn it back to Michelle is if there's any further information, the Canadian Blood Services website has lots of information about organs and tissues and living donation, as I mentioned earlier in the program, in multiple languages that you can see on the website. And so, Michelle, that brings me to the end of my portion of the presentation. So I will turn it back to you. Thank you so much for the opportunity to speak tonight.
You're welcome. And thank you, Darlene, for sharing your expertise with us. I know that this is a really popular topic in our PKD community when people are looking at the possibility of kidney failure in the future and wondering what their options are and wanting to know ahead of time what their future might hold. So we're just really thankful that you can share some of this real world information with us. Now we do have some time to answer some questions specifically for Darlene before we move on to the next speaker. I see that there have been a few questions already in the chat. You can also use the Q&A box if you prefer. It's a little bit more anonymous that way. Some of the questions I see, someone has asked, what prior work can be done to determine if I am compatible to donate to someone? I think they're meaning before they even know if the person is ready for transplant. Can they start the testing process before then, or do they have to wait until their recipient is at a certain point in their own journey?
That is a great question. And there's also, again, not to sound evasive, but some variability with that answer as well. The best thing to do, again, is to give your living donation program in your province a call. Let them know you have a transplant candidate in mind. You're not sure where they are in their potential transplant journey yet, but you'd like to see if perhaps you could potentially donate to them. The reason I suggest that as well is, as I mentioned in the process there, and I apologize, I actually didn't circle back to it, is the preemptive transplant. So if your transplant candidate, if their kidney function has come to a level where they don't quite need dialysis yet, but they could consider a living donor transplant before they are on dialysis, that's called a preemptive transplant. And so if you approach the transplant program within that specific window to be assessed to see if you are directed donation, there's that possibility that you could donate to that transplant candidate before they end up on dialysis. So great question. Thank you.
And the same person has actually asked, they live in a different country from the potential recipient in Canada. They want to know, should they be reaching out to the provincial group in their potential recipient's province to find out what pre-testing they need?
Yes, yeah, excellent question. And so, there is some general testing that's done, as I mentioned, for the donor health and safety. That's always the focus first. But the provincial transplant program where the recipient is the best to access, because once you get to that point where you potentially are looking at an OR or the kidney pair donation program, if there's anything specific that program needs to know that is best for that recipient, it's best to go to that home program. Now, that doesn't necessarily mean you need to do the testing at that program if you live in a different province. That program can liaise with that other provincial program so you can do the testing in your own province.
Awesome. There was another question that came up when you were talking about the testing process. You mentioned past travel history as one of the things that a potential donor might be tested on. What would that impact, or if people know ahead of time that there are certain countries that, for whatever reason, are not eligible?
Sorry, I should clarify that. When
Yeah.
we're looking at past travel history for organ donation, it's not anything that would necessarily prevent the transplant from happening. Organ donation is very specifically regulated by there's CSA and Health Canada standards. And so when you're doing part of your testing for the pre-workup, some of that testing is specific to regulations that all transplant and living donation programs have to adhere to. And so what they will do is they will ask you about recent, but also past travel. And so that's just so the program can potentially determine any potential risks of any transmissible diseases to the recipient. Again, not necessarily to stop the transplant from happening, but also it informs the transplant candidates team on how they can care best for that recipient after the transplant.
Right. I noticed that Alexandra, one of our presenters a little later this evening, has said in Ontario, the living donor team at St. Michael's Toronto would be the best place to call for information around out-of-country living donation. Maybe I'll ask her when she comes on. why that particular center is best for the entire country. But, um,
Oh no,
here she is.
sorry,
No,
I'm
go
here.
ahead.
Yeah.
Go
No,
ahead.
I don't mean that. I just mean as far as with any inquiries where the living donor is from out of country. St. Mike's has dedicated expertise in terms of working out of country living donors. And that's just from my experience in the living donors that we have within our TAP program, that I think all of them have went through there. And correct me if I'm wrong, Darlene, I think that may be the only center in Ontario that works up out of country living donors.
No, it actually can be done at any center. I know Ottawa and Toronto General will
Oh,
actually
Ottawa.
as well.
Yes.
Yeah.
Okay, so Toronto General, St. Mike's. Yeah, right. Okay. Yeah, no, great. Perfect.
Yeah,
Awesome. Well,
and
thanks.
quite often, if they're looking for living donors and a donor does come from out of country and it's not something that they have experience with, we do have a very strong network of living donor coordinators, and they do rely on each other. So, you know, I like to say that they make magic happen out there in the community, these living donor coordinators. So if they're not super experienced, they would likely reach out, Alexandra, to their colleagues at St. Mike's for advice.
I see someone else has asked in the comments, can we get the contact info for out of country? And I'm wondering, does that mean someone wants to know they are out of country and they want to know the contact information here in Canada to contact?
Yeah, so on the Canadian Blood Services website, if you have internet, you can go on and it lists each provincial program on there. And so the contact information for each provincial program. So depending on where your transplant candidate is, I would recommend to call that provincial transplant program and inquire about their out-of-country donor process specifically.
Awesome. One of the other things that I know I often hear from PKD patients is they may currently be at a state where their kidney failure has not yet, they may be stage 3 or stage 4, but they don't know what's going to happen when they can start to think about looking for a potential donor. So is there, what would be the best course of action for a PKD patient if they're contemplating transplant and wanting to kind of start the whole process or know kind of when they can seek to have a transplant?
Oh, that's an excellent question, and very challenging for the donor, right? Because if you have a potential living donor, they want usually to get started on their testing first. A lot of the testing that a potential living donor does, however, is time sensitive, which essentially means it expires after a certain period of time. So if the potential transplant candidate is not able to receive a kidney typically within that year that the donor has done their testing, then the donor has to repeat essentially their entire workup again. So I always suggest that, share your story with your friends and family. So if they are interested in living donation, when you're having that conversation with your general nephrologist, they will be able to kind of trigger you and say, I think your kidney function, perhaps we're at the time where you might want to consider living donation, and then you'll be ready to provide that information to your friends and family to contact your living donation program to get that ball started right away.
So if I am hearing correctly, then if you are the potential recipient, it really is dependent on what your care team, what your nephrologist is advising in your unique situation in terms of, are you ready yet for a transplant or not?
Yes. Yeah.
Okay. Well, if there are any other questions for Darlene specifically, please feel free to answer them. If not, we may move on then to the next presentation in our evening. And I'm not seeing any. So thank you again, Darlene. If you can stay around until the end of the presentation in case there are any other questions, that would be great. But we really appreciate you being here. And the next one up actually will be Amanda and Mary are patient stories. So Alexandra, you'll be after them if that's okay. So Amanda and Mary, if you can turn on your video and your mic. There you are.
Hi.
Awesome. Hi. So our next presentation tonight is going to be a patient story. And for those in our community who regularly read our e-news or our blogs or social media, you may be aware already, you may have already read Amanda and Mary's story because it was featured in our Voices of PKD a couple of months ago. Amanda is a living kidney donor, and she grew up knowing that PKD affected her aunt. And when her Aunt Mary needed a kidney transplant due to kidney failure from PKD, Amanda got tested and was approved as a potential donor through the Kidney Pair Donation Program. Mary obviously is already also here tonight, so she can give a little bit of a perspective about the whole process. But we're especially interested tonight in the donor process and what it's like when you know you want to be a living kidney donor and everything that you have to go through, what it's like from the donor's perspective. So Amanda, you can get started. I'm going to stick around and maybe ask some questions from time to time.
Sure. Okay, so ever since I was a kid, I told my Aunt Mary that I would donate a kidney if she ever needed one. I've never met anybody who donated any organs before. And I'm sure as a kid, I didn't realize what was all involved in actually donating. But I knew that I love my aunt so much that I'd do anything. Oh, sorry. I'd do something big for her if it came down to it. So for people that have PKD, ultimately, I wish they would all receive a kidney. But I put myself in a more reality position and started to spread the word and start advocating for those who do suffer from PKD. Sorry. So I wondered how life would be living with one kidney. But I did a lot of my own research and I got a lot of great information from the hospital and all my coordinators. I also had a great supportive team, including family, friends, my coordinator, and the kidney team from the LHSC. And that helped me better my decision and confirm that, yes, I want to go ahead and do this. The team from LHSC had informed me of all I needed to know. So technically they were my navigators, and they were very great. I am so grateful for them. And so kind of like what Darlene was saying, there is extensive testing, including the blood work, ECG, ultrasound, chest x-ray. So I did the full day of completing most of those tests in that day. It was a long day, but it's all worth it in the end. So when you first get started, it's good to keep motivated and dedicated to what you're actually doing. And because in the end, you are a hero and you're going to feel so amazing and you're going to be so proud of yourself. And a lot of people are so proud too. And as for the results, I feel like I got them back in fair time. And also, like what was mentioned, you can go get tested so far, and then they'll find out that you have an issue that you didn't even know you had. So that's good. And then, so the transplant team will tell you exactly what to expect. There is no surprises and no secrets. And they'll give you step-by-step directions and instructions and be by your side the whole entire journey. And so when I actually got to tell Mary that I was able to be a donator. I did not donate directly to her because we weren't a match. So I learned about the kidney paired donation program, and then I felt like I was helping not just Mary, but more people. And it's a really good feeling. And I learned about the kidney paired donation program pretty much right away because I knew that we weren't a match. And I feel like I'm really glad that I could help out a complete stranger. Um, they don't tell you anything after you donate what happens, but they did say it worked right away. So that's good. Yeah, I don't know my recipient's story, but I do know mine, and I couldn't be happier knowing that Mary was guaranteed a kidney, even though it was coming from a stranger. And if, nothing really was surprising to me because I was updated and I was kept updated very quickly and efficiently. Now, if I could wave a wand and make things better for both the donor and the recipient, it would definitely be that this disease wouldn't exist. But also that people could see the reality and that the process really isn't that bad. I was overwhelmed at how quickly they had found a match. It all seemed to go really fast all of a sudden, and to learn about the different blood types, and the recipient needs a specific blood type. You learn so much, and was asked about feeling anxious, and I think it's a pretty normal feeling to feel anxious about any surgery. Where you think of the outcome, your finances, because you will be off work, what recovery will look like. And I felt anxiety, but the thought of the recipient living a better life quickly drives away those fears and feelings. And then you will never feel totally prepared. But if you have a good support system, like I thankfully did, you won't have to worry because they're there to help you. For my recovery, it probably took about a good 2 to 3 weeks where I started to feel normal again. And besides the heavy lifting, I was doing all my daily activities by myself. Probably at the end of the 4th week. I'm a PSW, so I think I was off for about 6 or 7 weeks. It's not easy to roll a body sometimes. And I didn't have to worry too much about making dinners or like cleaning the house because I had people bringing me supper and bringing me frozen food that I could heat up. And so some people would ask, well, what if your kids need a kidney? And I just look at them and I say, well, what if they don't? And then I would hope that someone would come forward for them. So if I did have a spare kidney, I would donate it in a heartbeat. And my 10-year-old daughter, she already told me that, like, bless her little heart, that if I need a kidney, that she will give me one of hers. And if I had any advice to anyone considering to be a living kidney donor, it'd be that this decision is completely voluntary and free from pressure. Consider your pros and cons, talk to your loved ones, and make sure that you have all aspects of support. And for advocating, I think it's important for me to advocate because I have seen firsthand how someone with PKD has to live, and that is no life to live. The more we get the word out, the more chances we have at finding donors. So I was very lucky, and I got to tell my aunt that I was able to donate. So her daughter was at my house, which is weird because she never comes over. And I got the call and they said, well, you can donate. So I got her daughter, we went and bought a can of kidney beans. And this was in November, so it was around Christmas. And I wrote her a quick little letter saying, God bless me with 2 healthy kidneys, and I'm going to bless you with one of them. Merry Christmas. She couldn't even read Merry Christmas because she was crying. It just happened to be that her husband was home at that time. Her son had come for lunch. And I brought my mom with. So it was a really, really beautiful moment. There was not a dry eye. The video still gets us sometimes. Every time. But no, it's a beautiful gift. Like I said, I would keep donating if I could. After I donated my kidney, I became a organ donor for after I died. So
Awesome.
yeah,
It was kidney beans.
yes. Beans.
I was really struck by that beautiful story when you first shared it with me, and you wanted to share it with our community. It really is a special story about how you happened to tell Mary that you were eligible as a donor.
Yes, it was awesome.
Do you mind if I?
I
Sorry,
didn't trust
go ahead.
her. I didn't trust her. She was always pulling pranks on me. So when she gave me the Christmas present, I thought something was going to pop out at me.
Do you mind if I ask you a few more questions, Amanda, about your situation? I noticed one person is put in the comments. What was it like when you had the conversation with your children? I don't know. Do you have more than one child?
Yes.
Yeah. What was it like when you had the conversation with your children about having the surgery and what was going to happen?
Well, they're young, so they didn't really know, the whole process. But I did bring them to Mary's house when she was on her dialysis machine, and I told them this is why I want to donate a kidney. And they love their Aunt Mary too, so then they hated seeing her like that. So they just kind of went with it. And they were helpful too after in my recovery.
Now, I know from you having shared your story with us before that Mary had a few other potential candidates along the way that in the end didn't work out. How did it come to be? Can you tell us a little bit, Amanda, about what happened or what you had to do or what how that happened that you started the testing process? Like, did you have to connect with someone? Like, how did that work?
So yeah, a few family members did get tested, but I think my sister only had one more step, and then they found something with her kidneys. So I just went and did it.
I guess what I'm asking is for someone who knows nothing about the process, did it start with Mary, with her team kind of like, who did you connect with and how did you let them know that it was your turn, that you wanted to be tested?
So there's a number at the LHSC that you can call and say you want to get tested and to be a potential donor for Mary. And then you'd say like her birthday and whatnot. And then they send you the package.
Okay. So
Yep, and you just
Mary,
fill it out and
Mary, what was that like? Did you, when your nephrologist was letting you know that you were a potential candidate to receive a kidney transplant, when did you find that out, or when did they start that process with you?
They couldn't really do anything till I was down to 10%. Like, she had her name from the get-go, like, way before I was down to that. So Dr. Blake was my nephrologist at the time from Victoria Hospital. And he put down Amanda's name, her sister Trudy's name, and my daughter Crystal from the get-go before I was even looking. So we went that far, but as anybody knows, you have to be down to 10% before they can start testing. I had 2 brothers that tried, and they did find things out, so they were glad they tried because they didn't know they had these health problems themselves.
So
I still consider them heroes.
Oh yeah.
of course, yes. And once you found out you were a match, when you got that call, Amanda, kind of what was that like? What was that moment like?
I was crying on the phone. I was so excited. And they gave me a date. We didn't have the same date. Hers was May 11th, and mine was scheduled for June 8th, but I got bumped to June 1st. I called Mary right away, and she was in the grocery store. And I told her, and she was bawling, and I was
right in the
bawling.
grocery store.
So it was very, very, very exciting.
Yeah, that's so awesome. Now, what was the time difference between when you found out you could be a donor and when they actually found the match where then they were booking your surgery dates?
Oh gosh.
Is it a week? No, November.
Sorry, I think it was about 5 months.
Right.
Yeah, about 5 months.
And how soon did you know that you weren't going to be a match for Mary? And when did you find out about the kidney pair donation program?
That I found out pretty quickly. I found out that you are O.
I'm O negative.
O negative, and I am B positive. So that won't work. So instantly they told me about the paired program, and I was all for that too. And we were doing this during COVID times, so it was pretty tough, but we got through it.
Well, it's still, for me, I think every transplant story, every living donation story is a wonderful miracle. But yours in particular just really had a lot of magical kind of moments, didn't it?
It was better than Disney World.
Yes.
I think you owe me a trip there,
I can cook for you.
Yeah.
Awesome. Well, I don't see any questions right now. If anyone who's watching has any questions that they'd like to ask of Amanda or Mary, please feel free to drop them into the comments or into the Q&A section. And if not, we can move on. And I'm not seeing anything. Oh, so there's Alexandra. Well, thank you so much, Amanda and Mary, for sharing your story. At the very end of the evening, when we wrap up, I will gather any questions and we'll do it. But thank you so much for opening a door into a very, very personal and private situation and sharing what happened with you.
You're very welcome.
You're
Thank
welcome.
you. Thank you for letting us share.
Yes.
You're welcome. All right, so we'll move on to Alexandra if you want to. There we go. So our next presentation is going to be from the Transplant Ambassador Program.
Hi, everybody.
Hi, I'm just going to do a little bit of introduction and then Alexandra
Sure.
can do her presentation.
Mhm.
So the Transplant Ambassador Program provides support and resources for kidney transplant recipients and living kidney donors. And Alexandra here is the Provincial Coordinator for TAP. She's also herself a living kidney recipient and a peer support provider for TAP. So she'll be sharing a little bit about how she came to need a kidney transplant herself and what her life has been like since surgery. And she'll also be talking about how TAP can help kidney donors and recipients navigate through the whole transplant process. All right, Alexandra.
Yeah, hi, everybody. Pleasure to be here. Thank you, Michelle, for the introduction. Hope you can see my screen okay. Amanda, you know, what to both of you, what an incredible story, and so much of your story resonates with so many things I hear from our TAP donors, and you know, the reciprocal gift and what it's meant to you in your life is such an incredible thing to hear. But thanks for being here. I'll try to go through a couple slides quick, but this is very informal. I'm here first and foremost because I'm a kidney patient like all of you. And I've had a transplant, and my kidney transplant gave my life the best possible outcome. It was the best possible outcome to my kidney failure. And this is a bit of a wordy slide, but I think I really just want to get the point across. A couple quick things about me. Most importantly, I'm a kidney transplant recipient. My kidney transplant was preemptive. And so, as Darlene discussed, it's very possible to have a kidney transplant before you need dialysis. Those factors are variable in terms of where your kidney function is, in terms of what living donor prospects you have or are being worked up. But I was one of the 2% across Ontario that was a recipient of a preemptive kidney transplant. And there's a few ways that I advocated for myself to make that happen, as well as having the support of lived experience in my corner, which was irreplaceable in terms of helping me find my best possible outcome. And so because of what my transplant has meant to me in my life, I've really been incredibly motivated to advocate for transplant first, advocate for patients knowing, you know, the more knowledge you have, the better, the earlier that you have it, the better. And certainly if I was in a position where I had waited for my nephrologist to talk to me about kidney transplant, I am quite certain that my preemptive transplant wouldn't have happened. And that's just the system that we have now. And so in any case, while I don't have PKD, I had a genetic form of kidney disease, a very rare one, that was identified after my transplant in 2020 by an incredible nephrologist and researcher in London. Her name is Dervla Connaughton. And it was with her genetic kidney disease background that we were able to begin the process of genetic testing to determine what was the cause of this kidney disease that had affected my family for generations, including my mom, including my grandfather, including my great-grandfather, who actually died post-transplant, but of a sepsis infection as a World War I vet. A transplant wasn't quite as advanced as it is today. I am the Provincial Coordinator of the Transplant Ambassador Program since 2018. And as a result of that, I've been incredibly lucky to meet a very engaged, passionate kidney patient and donor community. As such, we've formed a nonprofit, which is the Kidney Patient and Donor Alliance, and that will be the long-term home of the Transplant Ambassador Program. But I also spend a lot of my time volunteering as a patient partner for a number of networks. So the Transplant Ambassador Program, and we like to use this as our mantra, It's a quote from American author Brene Brown, who's incredible, but really it reiterates that we do this because we've been where you are. We're here to share our stories, to be an ear, to be somebody that understands what you're going through because we've been there. And it's our hope that we can support you through finding your best outcome, through kidney transplantation. Doctor talked on this, but just to reiterate it and bring it home, and even from a fiscal side of things and the strain of dialysis on our public healthcare system, we know that the survival benefit of transplant versus dialysis, there's no question that it's better. Statistically, we know that transplantation offers patients a longer life, not only a longer life, but their life back. So freedom, quality of life, and whatever that means to you as a patient, there's no comparison to what a life on dialysis is like versus a life with a transplant. Though I don't know dialysis myself, not yet, knock on wood. I had my transplant when I was 30, so I'm fully prepared that one day I may cross this road again. But I would go through transplant surgery, through sharing what I'm going through to find a living donor 100 times over before I would ever want to be on dialysis. And, it is a massive strain on our public healthcare system. One patient on dialysis per year, and there's about 12,000 patients in Ontario on dialysis. One patient on dialysis is $100,000 to our public healthcare system year over year. One kidney transplant costs our healthcare system between $80,000 and $100,000, and it can last for decades. And so the alleviation that puts on our healthcare system, our nursing staff, all of it, but even more importantly, the gift of life that gives to patients, it's a win-win, no matter how you look at it. That just speaks a little bit more to Ontario transplant numbers, living kidney donation transplant numbers in particular. And so TAP really was born as a research strategy supported by the Ontario Renal Network around the question, and founded by Dr. Emma Garg, who's a renowned nephrologist, a kidney researcher in London, and Susan McKenzie, who is a kidney transplant recipient herself, around the question of living kidney donor transplants being stagnant for over a decade. And when we talk about stagnant, we're talking under 300 living kidney donor transplants year over year for decades. And you think about 12,000 people on dialysis in Ontario, with dialysis having a 40% survival rate on average over 5 years, it poses some important questions. So why aren't more patients considering transplant, considering sharing what they're going through to potentially find a living kidney donor? And why aren't more healthy people considering becoming living kidney donors? A few basics around our TAP program. So I think the most important thing I want you to take away from this is to know that we are all patients and donors. We're incredibly proud to be grassroots, to be patient-led. Though we partner with a number of organizations to move this message forward, we are not funded by any of them. And so the Transplant Ambassador Program is truly led by patients, kidney transplant recipients, and living kidney donors who are really just passionate to pay it forward, to share what transplant has meant to us in our lives as kidney transplant recipients and living kidney donors, to share the lived experience side of things that you won't necessarily receive from your nephrologist and your healthcare team. And we certainly aren't ever a substitute for that information. We never share medical advice, but we do speak to transplant in terms of starting to normalize and naturalize the idea of transplant for you. And so hopefully you can see us as folks who have both received and donated kidneys, who have really had our lives transformed by those experiences, and hopefully help you understand how we navigated kidney disease and kidney failure, dialysis, transplant, kidney donation, and help support you through that. We really believe the earlier the better. And the reason for that is we don't think it's really ever too early to start to naturalize the idea of transplant. Transplant is a big, scary word. A 3-hour surgery is a big, scary thing to consider. Asking somebody for a kidney, which we like to consider it, that's kind of the Americanized version, is the big ask. In TAP, we call it the big tell. And it's about that concept of I could never put anybody in harm for me. I could never ask somebody for a kidney. There's no way that somebody would ever do this for me. And, you know, I think that our volunteers and our stories are really here to support you through that and to help you see that people do this every day with minimal risk to their own health, and they give a gift to somebody of their life back, which we don't often have that opportunity in our lifetime. So we have some very simple, well, not simple goals, but we have some very clear goals. And through that, it's really about inspiring patients, inspiring family and friends of patients to consider the potential for being a living kidney donor and what that means through sharing our experiences as living kidney donors and as transplant recipients. You know, it's really also about identifying opportunities to overcome the barriers that patients and potential donors are telling us in our conversations. And so the Transplant Ambassador Program was piloted in 2017 in 13 hospitals across Ontario with regional renal programs. So those are hospitals that have either a multi-care kidney clinic, an MCKC, dialysis units, transplant hospitals. There are 6 transplant hospitals across Ontario, and understanding what could potentially be the impact of having the support of somebody with lived experience in your corner, and what could that impact have on living donor transplant rates across the province. And in those first few years, we saw an incredible impact. We saw 31% more living kidney donor transplants. We saw 42% more preemptive transplants in the 13 hospitals that implemented a Transplant Ambassador Program, and the rest of the Enhancing Access to Kidney Transplant strategy through URN, which really just involves reporting that data back, having a solid quality improvement team that includes transplant champions that work with our TAP ambassadors to implement a TAP program within those clinics. And so we know that it works. And so in 2020, we expanded to all 26 hospitals across Ontario with regional renal programs, as well as we've expanded to a number of hospitals out east in Nova Scotia and in New Brunswick, with hopes of carrying this support potentially nationwide. So just a couple quick resources I'd love to mention, and one of them is our TAP provincial webinars. And so just as you did tonight, you can register for our webinars. We have a great one coming up next week, and this is all about the big tell, and so it's quite pertinent, I think, to tonight's topic. And this is a panel of our transplant ambassadors across the province, both transplant recipients and living kidney donors, sharing, you know, how sharing stories helps patients find their donors and helped their donors find them. And so I think it's a really, you know, it'll be incredible. This is our 3rd edition of the Big Tell. It's our most popular webinar. We run one every year. And so if you are available to join us virtually from the comfort of your couch on Wednesday, please go ahead and send us a quick registration email. We'd love to have you. If I have another minute or two, I would actually love to do a very quick demo of our resources live on our website. But one of the things I think that is unique to TAP, well, it is absolutely unique to TAP, is our diversity across the province. And so we have over 200 TAP ambassador volunteers who are both living kidney donors and kidney transplant recipients. We have over 25 ambassadors that have PKD experience as recipients and also as donors. And so, you know, there's lots of us here that are happy to share our experiences with kidney donation, kidney transplant, dialysis with PKD, and what that's meant. Of course, you know, being generational genetic kidney disease has its own considerations and what those have meant to our folks and how they've navigated those specific challenges around PKD and transplant. But just as an example, we speak over 24 languages across our 200 and growing volunteers. And so if you do have a particular age, gender, kidney experience, background, or language, many other things, we would love to match you with an ambassador that can make you feel comfortable in terms of, or be the best match for you in terms of your considerations around transplant. Michelle, I see you popped up. Maybe you don't want me to do a live demo.
No, I absolutely. I just wanted to let you know, please feel free to share. The TAP has such a number of really wonderful resources for people who are considering transplant. So please go ahead and share all of the riches with us.
Okay, let me do it live because I think it's a little more impactful sometimes than the slides. So I have our ambassador website pulled up. I'm just going to turn my screen share back on really quick. Where are we? There we are. So this is our website. It's transplantambassadors.ca, and I'm just going to really quickly point out a couple of resources that I think would be helpful for this audience. And so the first one is our ambassador directory. And so there are a number of ways that you can connect with a transplant ambassador, that you can connect with one of our volunteers. As I said, we are implemented in all 27 hospitals across Ontario. So it could just be as easy as asking, you know, your kidney nurse, your nephrologist, your social worker, your dietitian, any of your providers that you see in clinic. Hopefully they're already sharing TAP with you as a resource, but if not, you can certainly ask for a TAP referral, and that will come to the TAP lead at your hospital. And if there isn't a great match for you within your geographic region in your hospital, that'll come to us virtually for a virtual TAP referral, and somebody in the province will reach out to you that we think will be the best match for you to speak with. We also have a number of ambassadors that are back in clinics across Ontario. So you'll see, if you do see somebody in a green vest that identifies them very clearly as a recipient or a donor, please feel free to approach us and have a chat with us. We're there for you. But this is our ambassador directory, and so it's from our from the homepage of our transplantambassadors.ca website. And one thing that I'd like to point out is that you can really self-serve here in terms of if there's somebody with your specific experience that you'd like to speak to. And so, for example, if you are a potential kidney transplant recipient, and bear with me as it might be a little bit slow to load. I know Rogers has been doing some work at finance today with PKD, and maybe you're under 40. Oh, no, that's going to get probably maybe a little bit too specific. Maybe, you know, so just in terms of our recipients with PKD, and you can certainly narrow that search down as much as you'd like to. But here you'll get a list of every single one of our TAP ambassadors that has experience with PKD. You'll see on their legend what other experience they have. And then you are more than welcome to send them an email right from our site. And so that'll go right to them, and you'll be able to correspond with any one of our ambassadors that you feel that you can relate to directly from our website. And conversely, you know, if you're a donor and you're just a living kidney donor, for example, like Amanda, who maybe wants to connect with a donor around her age. And so that would just be, you know, a really quick matter of not so quick tonight, but Amanda searching living kidney donor. Let's say Amanda was under 40 at the time of surgery, which she certainly looks like she was. She could have a little peek at living kidney donors under the age of 40 and see who could potentially support her there from our roster of living kidney donors under the age of 40. And again, can reach out based on who she thinks maybe she'd like to chat to. The other thing that's really important, and I'd really love to share tonight on this particular topic, is patient-seeking donors. And so the Transplant Ambassador Program has developed, unique in Canada, a resource for patients to be able to create a patient profile. So for example, and this is live, so you would just click patient-seeking donors from our website. You can create a patient profile right from our website. And this is going to allow you, and it's, maybe 10 minutes. We're going to ask you a few questions. Submitting doesn't make it live. It just comes to us on the administrative core team with TAP, and we'll work with you to make a live profile. So for example, I'll show you Althea's profile. And so we're going to encourage you to tell us a little bit about yourself, where you're at with your kidney function. We'll encourage you to tell us, anything that you're open to. Your blood type is great, your status in terms of where you're at with your kidney function. And if you have a living donor coordinator, or if you've already started your own transplant workup, that's also really great to include. And what this does is a couple of things. We'll give you a personalized link, so you can see patient Althea's personalized link right up there. And she's able to share that link with whoever she likes. Whoever she likes can share that link within circles again and again, over and over. And it's a way for patients to who may not necessarily be comfortable putting something on social media, or even if you are, this is a snapshot of what you're going through that you can share on social media. But unlike social media, once you tell us to take it down, it's down. It's not out there forever. It's kind of like a business card. And so I think about it when I was going through it. I was young. I was in my late 20s. I didn't want to be seen as sick. Or disabled, and I struggled with having this very difficult conversation again and again, especially looking for a non-related kidney donor. So I couldn't turn to my parents or my sisters, who would, usually be the first to come forward for you. I really had to ask somebody that wasn't related to me to give me a kidney. And as your kidney disease progresses, you're feeling less able to maybe have those difficult conversations and share these things with people that you don't necessarily even know very well. And so this gives you sort of a business card to share what you're going through. And it also allows potential donors, especially if you include either your coordinator in transplant clinic or a living donor coordinator, if you've begun your workup process and you know what transplant hospital you'll be seeing. There's no need for them to even necessarily contact you. They can say, yep, I know I need to call Beth at London and see where I may stand, and there's no pressure on either side. So really happy to report that we've had 7 transplants come out since last June of patient-seeking donors, and the connections that have been made through this website. The other thing is we've also heard from potential living donors who were either close to donating but not the best match in the end, or were motivated to donate and for whatever reason that donation didn't go through, but they'd still like to donate, but they don't necessarily know anybody that knows that needs a kidney, and they don't necessarily want to donate in a non-directed way. So currently, it's either you have an intended recipient or you donate it in a non-directed anonymous way, and there's not really any information around who you've helped in a personal way, or any communication available other than what's through the hospital, which is done anonymously. And so in this way, a potential living donor, somebody that's motivated to donate a kidney, has a pretty good pool of folks that they can look to say, yeah, I think I could really see myself giving a son and his 2 children their dad back, and maybe I'll give a call. So that's it. I think I probably went way longer than I was supposed to, but that's it for our top resources. I didn't have many slides left, other than I would really encourage you to sign up to our webinar registration list. and utilize our resources. And please know that we're here, and we can likely find somebody that has a close experience to what you're going through that will reach out. And we're not just a once and done. We're not just a phone call. Best of luck to you. Our ambassadors are trained to follow up if they've, if you've had a good call, if they feel like you've made a good connection, they'll ask if they can call you after your next appointment, or encourage you to reach out again if you have any questions. And so we're here because we're patients. We're here because we're donors, and we want to see all of you reach your best possible outcome through transplant too. I'll stop my share now, Michelle.
That's okay. And really, I am so happy to have had you share everything that you had. I mean, we will be sending out an email to all the registrants after, it'll be sent out tomorrow with all of this information again, which websites to go to, the resources that are available there. And then, of course, in a week or so, we'll have the video up on our YouTube channel. But there really are so many resources that are available that people maybe weren't aware of. So absolutely not a problem for whatever time you've taken. We do have a couple questions, and before I bring everybody back, some of them might be specific for you, Alexandra. Someone's asking, is the TAP program only for residents of Ontario? And to that, I might add, if there are people in other provinces who want to make use of something like this, what are the options for them?
Yeah, absolutely. We'll talk to anybody. So our ambassadors are aligned currently with hospitals in Ontario. We're all Ontario based, but a number of, we have expanded to Nova Scotia. So we're in a number of hospitals there, as well as New Brunswick. We'll talk to anybody. We can't always promise that we may know geographically what those processes are like. But to be honest, we don't really get a lot of hospital process-based questions. They're really, again, because we don't give medical advice other than, maybe what we chose based on what our circumstances were. And that's, again, from the perspective of our lived experience. And so certainly we will chat with anybody. We have a number of donors in our program, again, who have had donors from out of country. And so most of those, I know there was some discussion about that earlier. Most of those donations have happened through UHN, through St. Mike's Toronto. But they would be happy to share those experiences with you and how that looked. And there's any number of things. I mean, there are I think what I've realized in speaking as an ambassador and then getting to know all of our ambassadors later on is really that a lot of our stories might be different, but the feelings are the same, and we're really going through the same journey. And so absolutely, please feel free to reach out to us. So our email address is connect@transplantambassadors.ca. That will come to me. So you can always just email me directly too. I'm happy to put my contact information as well as TAP contact information. We have a 1-833 toll-free number. And so if there's any way that we can support you, regardless of where you are or where you're at, we'd be most happy to do that.
If someone was interested in becoming a transplant ambassador, they are a donor or they have gone through a transplant, what does that process look like?
Yeah, no, and we love it. I think paying it forward is one of the, and I'll say, like, I thought that coming into this, it would be, me supporting others, and it's become this incredible community of support. And I think I find these conversations more rewarding, and these connections that and I'll tell you, mostly based on my experiences, I'm speaking to patients who are very early on. And so most of my referrals are patients who are preemptive and getting a referral to talk to somebody with a transplant when they're in multi-care kidney clinic. So maybe dialysis isn't even on their radar yet, and not even something that they want to think about. And transplant is a big, scary word. But the sooner that you understand that kidney failure and kidney disease, it doesn't have to be a sentence on your life, that you can live a full, healthy, happy life. You can have children as a transplant recipient, as a kidney donor. You can travel, you can pursue your career, you can do really, no restrictions, dietary or otherwise, in terms of really, other than, being mindful of your medications and your transplant appointments. But even the transplant meds become very old hat, and they become less and lower dosages as time goes on. And so they're quite intimidating at first. And in that first year where you have your highest risk of rejection. But I will be 7 years out next month, and I'll tell you, they're so minimal now, and they're like my morning coffee and my, not my nighttime coffee, but they're so streamlined into my life in a way that I don't even really consider it. It's such a small price to pay. And as far as becoming an ambassador, you do have to be currently living with a kidney transplant, though many of our ambassadors have spent time on dialysis, have had multiple kidney transplants, or have successfully donated a kidney, and just have a passion to pay it forward. And so we do have an onboarding process. Your first step, again, in onboarding would be reaching out to me, where we'd have a chat, and then I would share, sort of what we ask of our volunteers and what's next. We do ask for a vulnerable sector police check, a little bit of online training, but otherwise, I'd be happy to chat with anybody who's thinking about becoming an ambassador, and would encourage anybody to join us, because it's a great community.
So, well, I wonder if I can bring back all of the panelists, and there are a couple more questions that may be for Darlene or for Alexandra. One of them is, someone is saying, at my age of 77 years, should I be a recipient? Not to be negative, but how long will I live anyway? Would a kidney be better going to a younger person? What would either Darlene or Alexandra say to this person?
Well, my first thought is extended criteria, and Darlene, you could probably speak to that more, with more medical, of course, with more medical background than I could. But from an ambassador perspective, we have ambassadors that have received kidneys in their 70s and even early 80s. With extended criteria, it could be that maybe you receive a kidney from an elderly donor that doesn't necessarily need 30 years out of that kidney, but that 5, 10, 15 years, it could be an incredible gift with where you're at. So I would say never rule it out until you know your eligibility and you talk to your nephrologist and your providers about it in clinic.
Darlene, do you have anything to add to that? I know that was another question we'd had ahead of this event, was about either donating or receiving a kidney, at a more elderly age, 80 or beyond. What are some of the considerations that your healthcare team is going to take into account in that situation?
I feel like that's really, it's a hard question to answer. I feel like it's a really personal choice. I have information. So the oldest living donor in Canada that I'm aware of was actually 83. And within the KPD program, currently our oldest transplant recipient is 84. And I know we tend to, you know, as humans, we like to like label and categorize things. And so age is a very important category for us all. But you know, that old adage, age is a state of mind. I always say, you know, it depends what you want to get out of life. And so kind of as Alexandra was saying, when we're looking at kidneys and their ability to provide, you know, what you need for life, there are, you know, older donors that perhaps that kidney won't necessarily last you, you know, 30, 35 years from a younger donor. You know, if you want 5 years off dialysis to, you know, be able to take the family to Mexico without having to figure out how to do hemodialysis in another country, or if you're on PD to drag all that equipment down there, you know, it really depends on what you want and what you see yourself doing. I think as Amanda and Mary were talking about too, you know, that going through that whole surgery and the recovery phase, you know, you have to make sure that you're prepared for that. And, you know, Alexandra mentioned as well the medications, you know, there are things post-transplant that will alter the way you do things now. And if you see a benefit to that, I always encourage somebody to investigate that for sure.
We have another question in the Q&A area. Someone has asked, can donors be of the opposite sex, or does the donation have to be a man to a man or a woman to a woman?
Alexandra, do you have any thoughts on that one first?
Yes, donors absolutely are not restricted by gender in any way. I'll tell you, my donor was the last person that I ever expected it to be. I live in Stratford, Ontario. My transplant was in London, she was not, she was 55 years old. She was my boyfriend's aunt, non-biological aunt at the time. And it was just a matter of, I kind of used an, you know, Ice Age patient seeking donors, where I had Beth Monteith's card and I just passed it out to everybody. And it was actually from my boyfriend's mom who passed along to her. And I didn't even have that conversation with her. She just went ahead and called. She was 55 years old, had children of her own. It was important for me to sit down and talk to her kids as well, to say, are you okay with going through this? Because they were around my age. And one of the things that her daughter said was, what if one of us needs a kidney? And Julie's answer, very simply and very, you know, it's so aligned with what you said, Amanda, as well. I would hope that somebody would step up for you after what I've done. And absolutely no doubt, if that day ever came, that somebody would. It's a very altruistic thing. But yes, no, there's no, in terms of even, I mean, I don't know, that's the first time I've heard the gender question, but there is a big myth about kidney donors needing to be related, and that's not even the case. Certainly the better the match, and often close genetic relatives are a better match and can affect the amount of medications and dosages of medications and things like that you're on, but ultimately your outcome would not hinge on that.
Awesome. Well, I wonder if I think Amanda and Mary are still in the background. If you would like to turn on your video camera, and we'll wrap up. There you are. I want to thank all of you for being here tonight. We've had some comments in the chat that people are really thankful for all the stories that they've heard and all the information that's been shared. And we're just so thrilled at the PKD Foundation of Canada to have been able to have all of you here and talk about this topic that's really top of mind for a lot of our community. So I just want to thank all of you and remind everyone that this has been recorded and we will be sharing it in about a week. There will be an email going out to the recipients in the next day or so with all of these resources and websites and links. And I'll even include the link to Amanda and Mary's story that we published on our website. If you would like to keep up to date with some of the news that we have about our PKD community, we have a monthly newsletter that you can subscribe to. Just go to our website, which is endpkd.ca, pkd.ca. And yeah, so I encourage everyone, if you're interested in hearing about the Big Tell, to register for that next week. And then I'll also let you know, we have events called PKD Mind Matters Chats, and we're going to have one specifically on the topic that we've discussed tonight on living donation, transplant, and living kidney donation and transplant. And so that will be in 2 weeks from tonight as well. If you would like to register for that, you can go to our website. So thank you so much, everyone. It's been wonderful, and we'll see you another time.